Indonesia right now have a reform in the health sector. One of the reform is on the primary health care, or we usually we call it puskesmas. In the puskesmas, we want to make them more intense to make our people to be healthy. Yeah. With something like strengthening the immunization, strengthening the screening, and give the people to make them healthy, something like what's called exercise and everything. So this is the way we are change our mindset from before is curative to promotive preventive to make our condition is happen. There are three objectives that we are want to do with this reform for the ILP, integrated primary care. First is, like I mentioned before the puskesmas as posyandu as pustu as the underborn the puskesmas is only concentrate in mother and kid. Right now we are in the whole life cycle from the baby and the adolescence until we are older. So this is our life cycle. The effort is, like I mentioned, strengthening, promotive, and preventive. The second is bringing health service closer to care network. So it means that we are go until the village and the hamlet, including how they are we go until the lower level of the people. The second, we have a local area monitoring. So we use the digitalization and monitoring through village level, because Indonesia is very huge country from the central until the decentralization until the lower. So we are need to digitalization to make easier to have monitoring and evaluate what we already done. So this is the three objectives from we are doing improving our puskesmas or health primary care. In this situation, like I mentioned, the integration of primary healthcare services is represent a concerted effort to organize and coordinate various primary healthcare. So we are coordination is very important in this situation when we have integrated primary healthcare and focusing on meeting healthcare needs. So we need to see on the healthcare need on the life cycle for individual, families, and communities. This is our key that we are reform our healthcare sector. And like you mentioned about the challenges, Indonesia, because we are the decentralization, the challenges is engaging the commitment and support from all level of government, not only in the central government but also in the local government. So how they are make a commitment, they are support what already we done to make sure that the puskesmas is have the standard and a good quality and good services to the people. And we are actually maybe most of the country have the same problem, the lack of doctor. If we have the lack of doctor, some of the puskesmas they didn't have a doctor. So this is our obstacle to produce more doctor to want to go to the puskesmas and asking the Indonesian doctor that work outside Indonesia to come back to Indonesia and go to the puskesmas. And the last is about the competencies and incentive for cadres, because like I mentioned, we not only have the puskesmas but also the lower level like posyandu and pustu. for Posyandu, usually we have a cadres. So the problem in that is how to make the cadre is continue have a capability and give them standardized competencies and incentive to them, because some local government maybe give it different different incentive. This is the obstacle that we have, that like I mentioned before, because we already reform and we already try to do the best. So currently, this is our data that I sent it to you, that currently 3,500 puskesmas, or about 87% have implemented ILP, integrated primary care. So we hope that we can handle 100% on the end of 2024.